Good afternoon. I'm Gaye Adams Massey, CEO of YWCA St. Paul, and I'd like to welcome you to today's Equity and Justice conversation. We'll be talking about the status of women and girls in Minnesota, and I want to thank you for joining us in this important discussion. Women and girls make up 50.3% of Minnesota's population, the majority, and we know that how they fare will also have enormous impact on our state's families, children, and more broadly on the prosperity of our state and local communities. We're very fortunate to have Gloria Perez join us for this conversation. Gloria is president and CEO of the Women's Foundation of Minnesota, a statewide community foundation that serves women and girls across the state. Through research, annual statewide grant making, policy, and multi-sector partnerships, the Women's Foundation works for gender and racial equity and for opportunities and pathways to economic security for women and girls. The foundation also champions work to advance the safety, health, and leadership of Minnesota's women and girls. For many years, the foundation has commissioned critical research to quantify and analyze barriers to gender and racial equity for women and girls in the state. In 2009, it launched the Status of Women and Girls in Minnesota research project in partnership with the Center on Women, Gender, and Public Policy at the Humphrey School of the University of Minnesota. Annually, data specific to Minnesota women and girls' economic status, safety, health, and leadership is analyzed and made available to policymakers, community leaders, philanthropists, and service organizations, among others. A hallmark of the foundation's approach is its community listening sessions, engaging the insight and leadership of those most affected by barriers and lack of opportunity. In 2016, the foundation launched the Young Women's Initiative of Minnesota in partnership with the Office of the Governor. The Young Women's Initiative, or YWI, is a multi-year, multi-million-dollar investment focused on eliminating barriers young women face and centering the leadership and long-term solutions of young women from across the state who are most impacted by those barriers. YWCA St. Paul works closely with the foundation on this initiative, hosting the YWI Cabinet of Young Women Leaders. This is just a snippet of the great work going on at the Women's Foundation, but hopefully it gives you a sense of their priorities and how they drive change across the state. Gloria has been president and CEO of the Women's Foundation since February of 2020. She brings wide-ranging experience to this role from her work in small business, in corporate settings, and in nonprofit human services organizations. She's the former president and CEO of the Jeremiah program and is a nationally recognized expert in two-generational strategies for reducing poverty. Gloria has shared that her unwavering commitment to gender and racial equity derives from her lived experience as a Latina, a native of San Antonio, Texas, and an active community member in Minnesota. Thank you for being with us today, Gloria, and for the important work you do in our communities. Now, Gloria has a short presentation to share with us, and then she and I will talk about some of the questions her presentation raises. Following her presentation and our conversation, we'll then have time for Q&A. So share your questions for Gloria by putting them in the chat. Gloria, it's all yours.
Thank you, Gaye. It is wonderful to be with you here. I'm looking forward to the conversation that you and I are going to have. And as you indicated, I'd like to start by just giving a quick overview of the Women's Foundation and how the status of women and girls really nests within the work of the foundation. So it's a pleasure to be with you all. And as a person who hails from San Antonio, I have to say I'm loving this Minnesota weather that is very warm. I'm sitting in our foundation offices in Minneapolis, which is land of the Ojibwe people. And I really am feeling very comfortable in this environment that we're in. So That said, let me share a couple of slides with you about the foundation as we get started. So, as a statewide community foundation, the Women's Foundation of Minnesota is specifically investing in women and girls across the state. We deeply believe in the power of community solutions, and those solutions are really led by our grantee partners across the state of Minnesota, including, as you said, Gay, with the YWCA, who are building pathways to end racial and gender injustice. At the foundation, we're on a mission to create a Minnesota where all women and girls can thrive. And we accomplish this work by focusing on three impact areas: economic opportunity, safety, and leadership. And we are providing access to opportunities for girls and women to build economically prosperous, safe lives and to grow as leaders. We believe that women and girls are at the center of families and communities, and I hope you and I get to talk about that more. Particularly, we are investing in those who are pushed to the margins and recognizing that when we make those kinds of investments, this will mean a transformation for all of Minnesota. So, really centering the experiences of women and girls who are experiencing the greatest barriers and investing in their solutions is really what we think will make our communities thrive. Since 1983, we've invested more than 32 million in communities around the state, and we do that through grant making, research, policy, and advocacy to move women to opportunities for thriving. Our research is something that has been part of the foundation since our inception, and we've been partnering with the Center for Gender, Women, and Public Policy at the Humphrey Institute since 2009. And the research is inclusive of gender expansive and trans women, representing the full experience of how we define women at the foundation. So, as I review some of the highlights of the research, we'll show how women and girls in the state face added barriers and opportunities based on the identities they hold. And the report is going to hold so much more than we're able to discuss here. Hopefully, we can put a link in the chat to the report for you to see. But my hope is to offer an opportunity for you to learn about the experiences of women, the lived experiences of women from across the state, and how that varies. In this moment of the pandemic and amid the global uprising for racial injustice, we are acutely aware of how a crisis can exacerbate inequities that have always existed at the roots of our systems. So, research, let me move to that. Why do we do research? Really, research that we fund and conduct every 2 years is a cornerstone of who we are as a foundation. We know that research is at its best when taken to communities, and we ask those communities how the research really resonates with them. And I think we're trying to advance that slide. So bear with us. But we ask not only how does it resonate, but like what is the experience of women across the state? What do they need to thrive? And how do they define economic security? We want to understand what is in the way of women and girls. So for us, research is not just quantitative. This report is in fact quantitative. It has publicly available data. It has some new research that was conducted by the center, but research for us is also listening to community. It's hearing that full lived experience of women and girls across the state. This past spring, as an example, we led a listening series across 9 communities to hear directly about the experiences of women, their challenges, their solutions, to better understand how systems must shift so that all women and girls in Minnesota can thrive. So we conduct this research to learn directly from and amplify the voices and experiences of our state's women and girls. And as part of this research, we invite other statewide organizations and funders to also begin from a place of understanding that people pushed to the margins also hold the solutions. On our next slide, I want to talk about the first element of the report, which is economics. This research lays the groundwork for some of what we have seen through the pandemic, in that women and Black, Indigenous women of color in particular have experienced much more severe impacts with lasting consequences. The status of women and girls in Minnesota helps us to understand the dual vulnerability that women workers have, and particularly that they've been facing during COVID. Through COVID, we've heard from our grantee partners across the state that they are in an unprecedented crisis. And this crisis didn't just end when the governor opened up the state, it continues. As Gaye indicated, women make up the majority of our state. They make up the majority of workers who are unfortunately are paid at or below minimum wage, even with advanced degrees. As we've seen in this pandemic, the work that women do frequently lacks the kind of security and benefits that include sick leave and all the things that people need, particularly when women are heads of household, which they frequently are. At the same time, we know that support for caregiving, including affordable, quality childcare, has moved increasingly out of reach. And women in these times are having to make a choice. We're having to think about, well, is the work that we do as frontline workers putting us at risk? Do we have the flexibility and opportunity to stay home and educate our kids, as in many cases has had to happen? And what do we do about caring for our relatives? So we see in this report that women's economic security intersects with every other issue in a woman's life, and it impacts her health, safety, and her access to leadership opportunities. On this next slide, you'll see that the first piece to this puzzle is occupational clustering. In this graphic, it depicts the ratios of women and men in different two-year degreed programs. And you can see a very clear illustration of the clustering. In higher education, higher levels of education, clustering continues. So fewer women in STEM, for example. And occupational clustering is one of the causes behind the gender wage gap. As a society, unfortunately, we place more value on jobs that are associated with masculinity. And so in Minnesota, women lose an estimated $400,560 in lifetime earnings due to the gender wage gap. And for women of color and Native women, we experience even greater losses. So as we say, we know that women are more than just one half of the population, that they are in fact heads of households, and they are also essential workers, and they are largely responsible for this unpaid work. The report it shows us that Minnesota continues to be a national leader in women's workforce participation, and that women in the state earn a majority of all post-secondary degrees, but yet these achievements have not translated into economic security. And so for large gender segregated occupations, which together comprise over half of all employment in the state, female dominated occupations have an average wage of $22 an hour, while male dominated occupations have an average wage of $29 an hour. The other part of the report is about safety. So we'll move to that slide. And unfortunately, violence is a reality for too many women and children in Minnesota. And we know that in the pandemic, home is not always a safe place for women and children. On this next slide, you'll see that 1 in 2 women in Minnesota report sexual violence, and 1 in 4 report physical violence from an intimate partner at some point in their life. And our research shows this before the pandemic, that violence against women is more prevalent than many people would like to believe. We could fill Target Field almost 18 times and let me stop again, 18 times with the number of Minnesota women who have experienced rape, physical violence, or stalking. Minnesota service providers are supplying important supports for victims, but a lack of resources can be a problem. So, as an example, on an average day in 2017, Minnesota providers served over 2,351 victims of domestic violence. Another 321 requests for services were unmet due to the lack of resources. So, safety is definitely a problem that we want to continue to address as a foundation going forward. The third area of the report is health. And as we have seen through the pandemic, health is directly tied to a range of economic inequalities, whether you're living in rural Minnesota and facing issues with access, or living in the cities as a Black single mother, or if you're an older woman living alone, you're being impacted by economic systems that influence your access to preventative care to keep you healthy and to address your underlying conditions and health outcomes. The chronic conditions that make people extra vulnerable are issues that we have heard through our COVID conversations, and they represent the cumulative effects of underinvestment in community health. And so we've seen that um, the impact of poverty, stress, and trauma, access to healthcare and food and housing are really creating a larger landscape of health um, inequity for women across the state. Interestingly, the 10 counties with the highest teen birth rates are all in greater Minnesota. So, youth in rural Minnesota are faced with more difficulties accessing sexual health clinics due to barriers, including fewer clinics, longer distance to travel, limited hours of operation, and confidentiality and privacy concerns. So, the rural areas of our state definitely lack access to significant health services. On our next slide, we look at the interactions between economic inequality and health. And we are now often talking about a factor that's always been there. So we've known that there are underlying and chronic conditions that are often part of a prism through which we see poverty, stress, and trauma. In the healthcare data, we are seeing that many young people are facing challenges to their mental health, which can ripple into challenges with their physical health and the choices that they make. We are seeing higher death rates due to COVID in Black, Indigenous, and other communities of color. And Minnesota women of color and Native women are at a greater risk than white women of developing and dying from certain kinds of cancer. We also see in the report that the cost of healthcare is a greater barrier for African American and Latino women. 1 in 5 Black women and 1 in 4 Latina women in Minnesota reported that they could not see a doctor because of the costs in the past year, while fewer than 1 in 10 white and Asian women reported the same. So Minnesotans of all races were helped by the insurance expansion facilitated by the Affordable Care Act. However, in 2017, rates of insurance in the state leveled off, and for some groups, they have declined. And so this is a worrisome trend that we're contending with. On our next slide, we have looked at the mental health, as I said, for young people, which is horrifically disproportionate for Native young women and also Latinas. Minnesota's teenage girls are 2 to 3 times as likely to attempt suicide as teenage boys. And among these, 1 in 4 Native American teenage girls has attempted suicide. As one of my colleagues once said, nothing happens without leadership. So on this last slide, and then we'll get to our conversation with Gaye, I want to talk about leadership and some of the progress that we've seen and areas where we can definitely improve, especially as we think about how institutions can help move the needle and create a stronger workforce for the future. what I would say is that when we think about corporate leadership on this next slide, we'll see that women's representation is on the rise in corporate leadership. But interestingly, at this rate, it would take 52 years for us to reach gender parity. And that is a long way to go. And so at the Women's Foundation, we are investing in young women who we know have solutions for the future. And that is one of the things that I'm so grateful for Gaye and the YWCA for partnering with us on our Young Women's Initiative, which is a partnership with the governor's office and in particular, Lieutenant Governor Flanagan. So I'm hoping that this broad overview can help you see how disaggregating data can help us shine a light and highlight the different ways in which a intersectional equity frame can help us consider solutions to approaching issues across our community. So with that, Gaye, why don't we open it up to a conversation? Anything that I've said that you want to dig deeper into, or if there are questions that we can respond to from the chat, this would be a great time to start that conversation.
Wonderful. Well, I have a few questions for you, and then we'll open it up to the chat. You know, one of the things that really struck me when you were talking was, although the research you were citing was conducted prior to the pandemic, it was really identifying areas that we've just seen so much struggle through during the pandemic and the protests for racial justice. You know, as you think about that, what stands out for you when you reflect on the status of women and girls in relation to the impact of the pandemic?
Yeah, it's a great question. I would say you're absolutely right that the way in which women and girls of color, Black, Indigenous women have been impacted really stood out to me. The, you know, high representation of BIPOC in low wage jobs and the fact that women were the first one out of the workforce really did strike me. And then, you know, being a Hispanic woman myself with lived experience at the center of my family, working with uh, so many women, literally being able to see the ways in which women were impacted as as many women left the workforce, still at the center of their families, managing childcare, managing the economics of their household, dealing with the health concerns that they might have for elders in their community. It really did really boggle our minds when we thought about this and the way that the pandemic had just really highlighted this for families. When I think about LGBTQ youth, and I know they are overrepresented in our homeless population. Again, thinking about LGBTQ, that was definitely something that stood out to me as well.
The pandemic just highlighted in a glaring way so many of those disparities and made them worse. You know, the recession attached to it, some commentators have called a she-cession because it's had such a disproportionate impact on women. But COVID really destabilized so many communities in lots of ways, with the shortages, the lockdowns, the lost jobs or changed working or school environments, not to mention the loss of loved ones. So many folks had to face choices about their work, how to manage risk to their families, schooling at home, as you mentioned. And nonprofit organizations like ours were really thrust into becoming a kind of first responder during the crisis to help folks meet basic needs. How were you all at the Women's Foundation able to respond to the crisis that the pandemic presented for so many?
Well, interestingly, I started at the foundation about 3 weeks before my first major decision was to have everybody work remotely. And I naively thought that we'd be back to the office within a month. But that said, the team really mobilized very quickly, reached out to our grantee partners to understand exactly what you're talking about, how they were being impacted. And the Women's Foundation has had a community response fund that we were able to deploy. Now, it wasn't nearly what we knew would be needed in the community. And so we invested 250,000 of our assets against a response fund, if you will, for COVID and our grantee partners. And we invited our philanthropy partners to co-invest with us. And it ended up that we've invested $1 million in COVID response funding for women and girls, specifically connected to our grantee partners. And so we used some of that money to seed new initiatives, to really drive some of the activities that we knew our grantee partners were engaged in, to help them amplify the work that they were already doing, whether it was having to move some of their supports to a virtual operation, whether it was to supplement care, early childhood care for community members. Um, Within the funding community, the Women's Foundation has had a majority of our grant making as unrestricted general operating to our grantee partners. So it used to be 75%, which is really high in
Mhm.
the philanthropy world. And we moved that to 100%. And that also, I think, was a way in which we could be responsive, and I'm really proud of the way in which the foundation has had meaningful, deep relationships with our grantee partners, so that we could just extend that trust and support, so that the nonprofits could really go about the business of being responsive to community needs.
You know, your response on that, how the foundation responded is really emblematic of the way you work with your partners. We've experienced it as different from many other organizations we work with. But I wonder, from your perspective, what's different about the way the Women's Foundation operates and works with communities and organizations, others like YWCA St. Paul, social service organizations.
Well, I think what's different is that, first of all, we are centering solutions and problems. We believe that solutions and problems are found in the same place. And
Mhm.
so, really centering the voices and the lived experience of our community members, and working with our grantee partners in that work, having a presence in the community, um, is one of I think, hallmarks, cornerstones of how the foundation has worked. And that, in my opinion, has been uniquely different about the Women's Foundation. And again, we're a statewide foundation. And so having that kind of a presence, where we can partner across the state, has been vital to the work that we're doing. And it bears out in the research that more investment needs to be made for women and girls across the state.
We've worked very closely with you on the Young Women's Initiative since it was launched. And I wonder if you could share with us just a little more about how the initiative and the cabinet came to be launched, and tell us a little bit about the blueprint for action too.
Sure. Well, again, my predecessor was part of a women's foundation movement where we were responding to the needs of young women across the state. And Minnesota, I would say, has been a leader in the responsiveness to young women as leaders. And we were noticing that the White House under the Obama administration was being asked to invest in men and boys. And so women's foundations came together and said, we really think that there need to be investments in women and girls, and that includes gender expansive folks across the state. And so the Women's Foundation and others began to gather young women from across the state in listening sessions, and that was really one of the it has been an underpinning of the ethos of the foundation to do listening. And so we listened to a diversity of young women from across the state, and they developed a blueprint for action of what needs to happen in order for women and girls to thrive across all sectors of our community with all identities. And that blueprint ended up being adopted in partnership with the governor's office. So this was under the Dayton administration. And what happened is we created a cabinet of young women who have then taken ownership and worked to provide the leadership at the legislature on behalf of the Women's Foundation to advance policies that will create pathways of opportunity for education, that will create pathways of opportunity for high quality and affordable childcare, that will create pipelines for educational access, that will create awareness about violence in our community. And so this Young Women's Initiative was really our collective impact approach to addressing opportunities for young women across the state. And we have engaged all sectors of our community: business, education, the nonprofit sector, public policy sectors, to work with us in supporting young women who are leading solutions across the state of Minnesota. We have also, through this Young Women's Initiative, invested in the solutions that women have identified for their communities. So we have an innovators program where these innovators are, coming up with ideas for the problems they see in their communities. So it could be a small business. It could be a support group that they've come up with in their community. It could be education for young children. It could be after school programs. These direct investments in young women from across the state have been part of how we have worked through our Young Women's Initiative. And then we've recruited an executive council of leaders, as I was saying, from these various sectors, who have taken the pledge to identify ways in which the power that they hold, the positions that they have, can support the efforts of these young women. So if we're working in an educational institution and these young women are advocating for pathways for higher education for young women, how are those educators and administrators in higher education supporting those efforts? How are they providing mentorship or informational interviewing opportunities for young women and gender expansive folks in our communities? How has corporate America identified internship opportunities that have a gender equity lens in their application? And so it has been a tremendous effort, and the Women's Foundation's job has really been to use the data, the research, and bring together through convenings, through collective effort, these different sectors to advance solutions for systemic change. We know that we can't ever raise enough money to get out to all of our nonprofits, and so that's why for us grant making is one of the levers that we use as an institution. But really, it is only one. The research, the policy advocacy that we do helps the narrative change, elevating visibility of the issues will have greater and lasting impact for systems change.
And the impact you have in empowering and activating all these young women leaders is tremendous too. You know, I know that in May, the Women's Foundation held an equity summit with its partners. And at the summit, you talked about building a new day for our community. Can you share with those of us on this webinar what a new day means to you?
Yes, absolutely. I think coming to the Women's Foundation was frankly a new day for me personally. Right, it was moving myself from a direct service organization where I was deeply involved with families, single moms, and their young children, and then working at a foundation where we're more focused on systemic change. Right. Well, the Women's Foundation has been around 37, almost 38 years. And the work that this small team has done over that period of time is really quite phenomenal. From the research that I mentioned that has been done over decades to the grant making. And so the new day for us is really about being bold and really claiming and owning the work of the foundation and being unapologetic about the importance of centering solutions with the people who are most impacted. And so again, problems and solutions are found in the same place. And so for us, it has been to more boldly stand for that, to more boldly call out our commitment to being an anti-racist organization, to recognizing that we are all inextricably connected and that our race and gender and our place are key ways in which our identity impacts the experience that we have as women, girls, and gender expansive folks across Minnesota. And so this new day for us is about recognizing the sense of urgency that harnessing that sense of urgency that the pandemic and the uprising for justice have have raised the consciousness in our community and taking advantage of that. Because like I said, for many folks, we've known that these disparities exist in our community, but we haven't really been able to harness the public will to create the kind of change that we want. And so that's the new day. It's about getting comfortable with uncomfortable conversations and also getting comfortable with the fact that um, we have to think differently if we want to have different results. And that means that when we do that, we may fail right at first. We're going to try new initiatives that have not been tested before, and so we need to be willing to experience that and then to evaluate and analyze and then re-implement our efforts to create the change we want to see.
It's great. Well, you've talked so compellingly about these issues, but when we think about how we can take action and make change at the individual level, do you have recommendations for folks who are listening on what they could think about doing, how they can make a change?
Yes, thank you. I've definitely thought about this just for myself and with our donor partners and community members who have asked this question. I think it is in the ethos of the organization about listening to community and listening to understand and to continue to ask why and not be satisfied with what we initially see and or perceive to be the issues. Like, how do we get to the root cause of the problems that we see across our community. I was recently in a conversation with our board about not being bystanders that don't speak up, but really being bystanders that are actively calling out what we see and recognizing that that has some risk to ourselves as individuals. So just making that analysis of, where can I speak up in support of equity and justice and inclusion, and where can I develop relationships across difference, which will only make us smarter. And then I think it is on an individual level, reckon with that feeling of discomfort and be okay with that, because it is pushing through that discomfort where we will have our eyes opened to new solutions and opportunities of thinking differently.
So true. We've got a number of questions in the chat, so I'd like to open up our conversation so others can have a chance to get your insights on the areas they have questions about. So Nikki, can you tell us what our first question is for Gloria?
Yes, I can. So in the Q&A, the one question we have is, what opportunities does the Women's Foundation have for 25 years and older women?
Great question. So as a foundation, we are not directly working with women and girls ourselves. We don't have volunteers that we are deploying into communities, but we do have participatory grant making that we do as a foundation. So that is one way. We have, thought partners from communities. We have storytelling that needs to be done across communities. And as I look to the future, as I was saying about the Young Women's Initiative really leading and owning our policy agenda and work, for every person who has a, the ability to vote, you can become an ally of the Women's Foundation, follow the policy initiatives, that we are working on, be a voice for us, be an advocate in your community. Those are the kinds of opportunities that we would have. So I'd say, please join our mailing list. As we look to the future, we want to activate that kind of engagement from across the community, because we know how important every vote and every voice is across the state of Minnesota.
Thanks, Gloria.
Yes.
Dina, can you share the next question?
Yeah, so one of our questions is about how does the foundation really help identify inequalities that are systemic, as oftentimes it's a normative part of life and sometimes those things can be unseen?
No, that is a really wonderful question. It is about looking at the systems and practices and policies that exist in our institutions, right? And asking the question about how that particular policy was informed and formed. How are the various identities of race and gender and place and disability and immigration status and all the other identities that we hold, how are those identities impacted by those policies? And then if in fact the policy is not conducive for the whole of women and girls, for all women and girls across the state of Minnesota, then how can we begin to create changes? There has been an example of in the disability world, how curb cuts were made specifically for disabled folks to give them access and how once those changes were made, so many other people benefited from that curb cut. So if we're talking as an example, even about, let's say, the wage disparity, if we can center the people who are most impacted in that disparity. So if I'm looking at women, we're talking about the Latina and uh, Native American communities earning less compared to other women with other identities. How do we center those communities in the work that we're doing around wage equity? And in doing that, I think all women will have opportunities for better wages, more equitable wages.
Thanks, Gloria. Nikki, do we have another question?
We do. Everything we do has a political dimension. How do you work with the political arena to arrive at anti-sexist and anti-racist outcomes?
What a great question. Yes, everything is political, isn't it? It's true. If it's personal, it's political. But the Women's Foundation is a nonpartisan organization, and we are very clear about our values of investing in women and girls and centering, the folks who are most impacted by issues and lifting up their voices in the solutions. And so regardless of whether you are an independent, a Democrat, or a Republican, if we can have a conversation about how to center women and those people most impacted by the problems, we are happy and welcome the partnership of people that are willing to center those folks in not only identifying the problems, but creating the solutions. And so it is a very complex and a very, it's all about relationships, right? And it's about building those trusting relationships across parties, and really having the courage to ask questions and help people see the way in which policies have left out, in this case, women and girls and gender expansive folks in their design, and being unapologetic about asking our legislators to make sure that those folks are considered in the solutions.
Thank you, Gloria. Dina, do we have another question?
Yes. So sometimes when we're talking about this kind of data, we're really, it's elevating a lot of disparity and inequalities. Can you just talk a little bit more, Gloria, about the work on the data that you are seeing that kind of uplifts joy, and the different positive things that we're seeing, like that encourage us to continue on in this work?
Absolutely. And we all need to have a little joy in this work that we're doing. And as I said, we are seeing progress. One of the ways I think that the Women's Foundation has created progress is in the area of sex trafficking. And as an example, now the Associated Press can no longer talk about child prostitutes, which is language that used to be used before the Women's Foundation created the Minnesota Girls Are Not for Sale and campaign. And so, that is changing the hearts and minds of people is, I think, around sex trafficking is something that we can celebrate. The fact that we are now having these kinds of conversations about the intersectionality of gender, race, and place, and how our various identities impact our lived experience, I think is progress. The fact that when we are reckoning with these injustices in our community, that we see so many young women taking, to the streets, having conversations, really being unapologetic about what they see as justice, making the links between, climate change and health justice and so forth. Like, the power of young women gives us a lot to celebrate. I'll also give you another example locally. More recently, we've had a young woman who came through our Young Women's Initiative, Halal Ibrahim, who was just recently celebrating a partnership, an entrepreneurial partnership that she has with Nordstrom's nationwide. And Halal, as a young woman, was involved in sports and wanted a hijab, a headscarf that was, fashionable and conducive. And so she started designing these headscarves herself. She had a part-time job at a hospital where she was working, had a hijab when she was at work, and started, sharing these headscarves with her colleagues there. Well, fast forward to the pandemic, the Park Nicollet system turned to her, and with her help, they were able to develop medically appropriate hijabs for not only workers who needed to have these sanitary headscarves, but also for patients that were coming in during COVID. And so that just mushroomed into an opportunity for Halal. And then she was able to then develop this line of fashionable hijabs that are now being sold through Nordstrom's. And so her business has just exploded. And I think she has, in her business model, included opportunities for young women to intern and have business training and continue to, be entrepreneurs in their own rights. And so I think there are so many bright spots, frankly, across our community. And so I appreciate the question and opportunity to really highlight just a few of concrete and systemic changes that we need to continue to highlight so that we can inspire this work to continue.
Thank you, Gloria. Nikki, I think we have time for one more question.
Sure. So Gloria, in what ways could fathers be involved to help support and strengthen ecosystems in ways that increase maternal and child social determinants of health? Of course, with the caveat of when it's safe and legal to be able to do so.
Yes. Well, that's a very good question. Well, I think one ways that fathers can partner with us, first of all, it's to really examine the stereotypes that exist as we are, as they are interacting in communities, and to really challenge those stereotypes that exist, and the strict gender norms that we have all been sort of socialized into. So really having an open mind. When we think about maternal and child health, I think to continue to advocate for access and policies that will create opportunity for prenatal and preventative proactive health screens by women and girls, creating opportunities in our healthcare system where women, Black, Indigenous women of color, feel like we are seen and that our unique experiences will be addressed, I think is critically important. And so seeking out clinics and physicians that can address the diversity of our women and girls across the state of Minnesota is really important. And I think just in general, being sponsors and supporters of activities for women and girls that will keep us healthy. So it could be everything from, sponsoring a youth group through your corporation, or you know, hosting neighborhood events in your community where men are seen as partners, allies in this work to advance equity and justice for women and girls is really important. So thank you for the question.
You know, I think we might be able to squeeze one more in.
Yes.
Dina, do you have another question for us?
We have a couple questions in here, so I'm just trying to look quickly around what maybe we haven't talked about as much. How about what advice do you have for either one of you? What advice do you have for young women running for office?
Oh, sure. Well, and Gaye, I'm happy to have you share your thoughts too. But for young women running for office, I think it is in the same spirit that we've talked about. Being bold is really important. You know, starting at the local level, understanding the needs of communities. So running for school board, you know, running for your city council, getting, you know, joining a campaign committee, being a contributor to a campaign, researching those issues. I think those are really important ways for women to have the experience and build your confidence in taking that step. And then, you know, I would also say that the networks that we can create in our communities across generations and across our cultures are really important. So being an active participant in community, creating some of those networks for yourself, or tapping into the ones that exist. So in Minnesota, we have Women Winning. They support candidates who are pro-choice in this community, but you know, looking for organizations like Women Winning that can be a backbone and provide you with some guidance would be one suggestion that I have. Gaye, what else would you offer?
I think you're right on the money. I would just say that, you know, one of the things that gives me hope as we face so many challenges in our community is the leadership of young women and young men. And I think I would just encourage any young women interested in public office and taking that kind of leadership role to have confidence that we need your voice and your leadership, and do the kinds of things Gloria was talking about to build your support system and your learning and your skill set so that you can be most effective and successful. I'm excited about seeing more young people, young women in particular, step up to this kind of leadership. And I would challenge those of us who aren't 25 anymore to acknowledge the leadership young women bring and create that support system for them.
That's exactly
to help them rise. We need it.
Yes,
Well,
you know, for so long, I used to always think about mentors for myself and that were, you know, of older generations. And I'm now thinking about mentors for myself of younger generations.
yes.
So
Yes.
as young women and men are thinking about that, how can they be mentors to those of us who are no longer 25 Gaye? I think that's important. So
You're right on the money.
we have a lot to learn.
Well, I'm afraid this is all the time we have. Gloria, thank you so much. Just wonderful as always.
Thank you.
And I'd like to thank all of you for participating in this conversation this evening. I wanted to let you know that if you have interest in talking further about these issues, we'll be hosting a coffee break. That's what we call it, a coffee break conversation on Friday morning that will provide an opportunity for a deeper dive on some of the topics we touched on this afternoon. And you'll receive an email with more information. I just have to tell you too that at YWCA St. Paul, you know, our mission is around eliminating racism and empowering women. And having these kinds of meaningful conversations is one of the ways we promote understanding and action in our community. So I hope you'll take time to visit our website to learn more at www.ywcastpaul.org. We also recently launched this year's 21-day Racial Equity and Social Justice Challenge. You can find that on the website as well. So I hope you found today's conversation inspiring, and it's sparked a new commitment to help advance equity and systems change. Thank you again, Gloria, and to all of you. It's really been an honor to spend this time with you. So thank you and good evening.
Thank you.